All right. I think we might get going, shall we? So big welcome back to the G2Z online event series. Thanks very much for joining us. In the spirit of reconciliation, we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islanders. My name's Nell Thompson and I'm the coordinator of the National Getting to Zero, or as we call it, G2Z program. I'll be hosting the webinar for you today. However, we will blame any glitches on Zoom or the internet gods or on someone else. It's nothing to do with me. Getting to Zero was developed by the Animal Welfare League of Queensland and they continue to support it to this day. G2Z offers its consulting, support and educational services at no charge to local governments and not-for-profits across Australia. Our focus continues to be on companion animal welfare and management issues such as strategy, legislation, operations, programs and community engagement, working towards reducing intake to pounds and shelters and keeping pets in their homes. We invite people to take a look at our website, g2z.org.au, and sign up for our regular e-news, connect with us via social media, and get in touch with us to see if we can help or to have a chat about the issues that are facing your organisation or your community. And so to today's session. Once I hand over to our presenter, there'll be around 50 minutes of presentation and around 10 minutes of question time once the presentation has concluded. The recording of this webinar will be accessible via our website to everyone to watch at any time. We're going to ask that everyone mutes themselves during the presentation unless our presenter indicates otherwise. And if you have any questions, you can start putting them in the Q&A box and we'll get to them as we can at the end of the session. If you have very quick questions that relate to your understanding of the content, put your hand up and we'll try and get to you during the session. As always, please excuse any working from home background noises that may filter through. I'm very happy to have Dr. Joy Verinder here with us today. I have the pleasure of working closely with Joy, and I'm sure many of you know her work. Joy is Strategic Director of Animal Welfare League Queensland and its national programs, the National Dissexing Network and Getting to Zero. She currently works with local and state governments, veterinarians and other animal welfare organisations developing and providing programs to prevent unwanted cats and dogs. She has a PhD in animal ethics, a master's degree in strategic management and professional ethics and government. Over the past 40 years, she's been a teacher, deputy principal and in several secondary schools and involved in numerous animal organisations, government and university animal ethics committees, and state and federal government advisory groups. Over to you, Joy.
Thank you, Nell. Thanks very much for that introduction. Hello, everyone, and welcome. I'm going to turn my video off here so that I can still access my notes because I don't have a second screen working here at home. So I hope that's okay, but I'll join in again, hopefully in our chat at the end. So, this presentation explains how NDN supports councils across Australia to run a well-structured cooperative desexing program, which we think is the most important strategy to prevent stray, abandoned and unwanted cats. We know that there are many councils who are now thinking of or running their own desexing programs, but they may be struggling to manage them or are not sure how to structure them. There's also many communities that have volunteer organisations or not-for-profits who run desexing programs without any council funding. And so hopefully this presentation will help you to persuade councils to contribute to these programs. Cats are the main focus today in this presentation because of the more prolific breeding rate, which has led to double or sometimes triple the euthanasia rate of cats than dogs in most Australian states. There are usually a greater proportion of abandoned wandering cats than dogs in the community and kittens than puppies coming into pounds and shelters, except in some regional areas where there are still wandering dogs in oversupply. So the data in this presentation is all about cats. However, if your community needs support for a desexing program for dogs, the NDN Cooperative Desexing Program can include dogs as well as cats. Some councils we currently work with have included dogs where there is a strong need to prevent unwanted pups and wandering stray dogs. So I'd now like to talk to you a little bit about the history of this program and data to show the success of low-cost dissexing programs that led to the development of this national program. As you're probably aware, the National Dissexing Network is run by the Animal Welfare League of Queensland, which is based in the Gold Coast, which has a population of about 630,000 people, and it's the second largest council by population in Australia. We manage all the strays for the City of Gold Coast Council, as well as take in most of the surrenders. We also manage the pounds for the Brisbane City Council, which is the largest council by population in Australia with a population of 1.3 million, and support other smaller councils in Southeast Queensland with their animals as well. Because AWL Queensland manage all the strays and operate the only shelters in the City of Gold Coast, we have been in an ideal position to gather data for the whole city. Our aim from 2001-2 was to apply as many effective strategies as we could to prevent unwanted cats and dogs and to achieve zero euthanasia of healthy and treatable cats and dogs. So you can see here in the data, way back in 2001-2, we were taking in about almost 4,000 cats a year and euthanizing 52% of them. Fast forward to today, euthanizing, 1,930 of them, or about 50% of them. Fast forward to today, and we have reduced our intake of cats by 52%, and our euthanasia rate has been reduced by 91%, so that in the last financial year, we only euthanized 176 cats, and that was cats that were untreatable, which is less than 10%. You can see in this graph of all Gold Coast stray and surrendered cats, the decrease in incoming numbers of cats, the blue line, and a decrease in numbers euthanized since 2001-2 in the City of Gold Coast. You can also see since 2016-17, we have reduced intake to a manageable level. It's been fairly stable, and euthanasia rates have stayed less than or equal to 10% of all incoming stray and surrendered cats for the whole city since then. This graph compares data for intake and euthanasias per 1,000 residents. Recent data from the last couple of years from Victoria showed an intake of 9 cats per 1,000 residents. In the City of Gold Coast, we used to take in 9 cats per 1,000 residents in 2001-2, and now it's down to less than 3 cats per 1,000 residents. This is lower than both New South Wales and Queensland's overall intake as well. Euthanasia rates in Gold Coast are similarly much lower than other states and Queensland overall, and we have reduced them from 4.5 cats per 1,000 residents in 2001-2 to 0.3 in 2020-21. Because we've achieved and maintained such a low intake and euthanasia rate for the second largest city in Australia, we've been offering support to other councils to introduce similar programs that we have found successful. We believe low cost or free dissexing of cats and kittens, preferably by 4 months of age, is the key strategy to prevent unwanted cats and kittens. Low cost dissexing has been offered on the Gold Coast through establishing a community veterinary clinic. This was established in 2001 to provide not only year-round access to low cost or free dissexing, but also to ensure that no animal goes untreated or is euthanized simply because an owner can't afford to pay to treat their animal for normal services. We now have 4 such community vet clinics, 3 in Southeast Queensland and 1 in Tasmania. This enabled offering free dissexing of mother cats for people surrendering litters of kittens, and enabled them to keep their mother cat in many cases. Anyone who is thinking of surrendering an undersexed cat or kittens today is encouraged to dissex them by being offered low cost or free dissexing to prevent them having to be surrendered at all. We also encourage vet clinics to desex kittens by 4 months through seminars on the safety and benefits of desexing at that age, and hands-on practice for vets and trainee vets in our community veterinary clinic using shelter animals. To give people easy access across the large city, we also met with local veterinarians and encouraged them to participate by offering a set low-cost program for just 1 month each year. We provided the promotion and involved our local council to contribute as well. AWLQ then started the National Dissexing Network in 2004 to enable access to low-cost dissexing across Australia all year round. Because most communities didn't have a community veterinary clinic, every vet clinic across Australia was contacted to encourage them to offer reduced dissexing prices for pension concession card holders and list them on our NDN directory so people could find them. NDN also encouraged organisations who ran low-cost dissexing programs with their local vets to list these programs on the NDN directory to help people find them as well. National Dissexing Month was started in 2005, which encouraged vets, even if they couldn't join in all year round, to join in for at least 1 month and offer dissexing to all pet owners at a reduced price before the spring breeding season. However, across these programs, and despite greater awareness of the National Dissexing Network, some clinics, while being very happy to participate, others were not. And only a small proportion of vet clinics actually choose to participate out of all the vet clinics in Australia, the 2,000 vet clinics in Australia. So we realised this wasn't enough. Volunteer groups and vets by themselves couldn't fix this oversupply of cats. Councils are responsible for animal management for the whole community of their cities and shires in Australia. And this is a community issue which needed to be funded by councils to be proactive in preventing wandering cats to benefit owners, non-owners, cats and wildlife. So the first NDN Cooperative Desexing Program started in 2010. Queensland Government at that time contributed $20,000 for councils to trial new desexing strategies. We worked with all stakeholders to introduce a breeder permit system in the city of Gold Coast, and to support people to prevent breeding, we introduced an ongoing low-cost dissexing program with the support of our community clinic and local vet clinics across the city. City of Gold Coast Council then continued to contribute from their animal management budget. Since then, over the last 10 years, we are seeing a transition from a reactive, punitive approach in animal management to a more proactive, preventative approach occurring, working with communities to identifying the reasons why the community is struggling to manage their animals and providing support, with a great increase in councils interested in offering dissexing programs. There's been a huge range of dissexing programs offered by councils. However, some programs are more effective than others to help the most disadvantaged in our communities. Some councils have just offered residents a $50 voucher toward the cost of the dissexing. However, as some vets now charge $250 to $500 to dissex a female cat, residents on low income still have to pay at least $200 to $450, plus an extra $70 to $100 if the cat is pregnant or in season, which they cannot afford. Another model was the AVA scheme, operating for many years in Victoria, and I believe still does. The vet charged their normal rate discounted by 25%. The issuing council paid a set amount directly to the veterinary practice. The pet owner paid the remaining amount of the dissexing fee directly to the vet. However, this was confusing in the sense that each pet owner probably paid a different amount at a different clinic, and it was difficult for the owner, who can still be required to pay a substantial amount which people on low incomes simply cannot afford. Some programs have only been available for short periods of time, for a month or two. Kittens can be breeding before there is an opportunity for people on low income to access the program. And often people may not hear about the program in time or be able to get organised to access it while it is available. Some programs have also had prohibitive voucher conditions, like a maximum of 2 vouchers per household, or pets must be vaccinated and have a current vaccination certificate, or if a pet is an older female, an extra charge applies. So we decided to create a program that was more encompassing. So the Council NDN Cooperative Desexing Program is ongoing all year round. It has a set low-cost affordable fee or is free for the resident and is targeted to help all residents in need. So this means not just pension concession card holders, but people on low incomes, people with large numbers of cats, and residents willing to desex and adopt stray unowned cats. It's called a Cooperative Desexing Program because the costs are shared by owners, councils, local vet clinics, and the National Dissexing Network. The NDN manages the program free of charge for councils, so we provide the staff and the office resources to contact the vets, receive all the calls from the residents, issue the vouchers, manage concerns, pay vets each month, and keep records and provide reports to councils. The other parties pay according to this table. This is our standard rate. So the owner for a male cat castration pays $50 and for a female cat castration, $50 as well. We've changed this year to be the same rate for both males and females. It used to be different. The council then put in $70 for a male and $150 for a female out of their budget. And the vet receives $120 for a male cat in total and $200 for a female cat. These prices are reviewed and adjusted as needed every couple of years to maintain a fair payment to vets. If you're interested in NDN providing a program in your area, please contact us for current pricing. So participating vets agree to receive a set reduced payment that still covers all wages, which is the vet nurse and receptionist, and material costs for the procedure. We do this to maximise the number of cats desexed with limited public funding. Vets also benefit by being part of the program because by reducing the oversupply in their city or town, it in turn reduces their having to euthanise unwanted animals, and also ultimately their requests for free services for people who are taking in cats that they really can't afford. Consistent conditions apply in our program for participating vets. So low income earners can afford to participate. It's 24-hour pain relief included, no requirement to vaccinate before desexing, and if cats are pregnant or in season, owners are not desexed for an additional payment. That payment comes from the council fund, $55 from the council fund. Council NDN cooperative desexing programs can also be offered at a lower payment. Some councils have decided to reduce the amount the owner pays to just $20 or $30, and the council pays the balance. And they can also offer it free to their residents. So the owner might pay $0, the council puts in $120 for a male cat desexing or $200 for the female cat desexing to pay the full price that the vet receives. So low cost versus free desexing. Consideration needs to be given to that. The NDN Cooperative Desexing Program has asked residents to pay a small proportion of the desexing cost, which is usually affordable from their pension or low income, with the aim of maximising the number of cats that can be desexed with limited public funding. People who access the NDN programs generally indicate they are happy to pay $50. In fact, they're usually delighted. However, there may be others who are not contacting us who are not willing or able to pay this amount. If council can afford to cover the whole vet payment and still desex large numbers of cats, particularly in targeted low socioeconomic areas to get a high desexing rate per 1,000 residents, providing free desexing to people in need or all residents is worthwhile and possible in our program. Where free desexing is absolutely needed is for semi-owners. People who've taken in a stray cat, for example, which has been pregnant and often end up with 3 to 4 kittens. These people want to prevent breeding, but they are unable to pay for all 4 to 5 cats to be desexed. By providing free desexing and microchipping, they are happy to take ownership of the cats, and the numbers of cats they own will gradually reduce over time instead of getting out of control. Groups who are willing to organise dissexing and care for unsocialised cats living and breeding in their local area and rehome them where possible also need to be supported with free dissexing. They are providing a community service and reducing council workload. An example of where targeted dissexing has been very successful is in Banyule Council. In 2010 and 2011, 1,004 cats were impounded and 578 cats were killed, which was 58%, not dissimilar from how we were back in 2001 too. Jenny Cotterill from Banyule Council introduced a free dissexing program which started targeting one postcode of 3 suburbs with the largest number of nuisance complaints and surrenders. In 2012 to 13 and 2013-14, an average of 40 cats were dissexed in each year in these postcodes. More dissexing was done over 4 years, targeting this postcode, but then was also offered to any resident. Since 2018-19, fewer cats needing dissexing are presenting themselves, and there's been an average of 75 cats desexed per year. By 2019-20, Council had paid to dissex and microchip 780 cats free of charge to residents. And so by 2019-20, 152 cats only were impounded and 24 euthanised. Jenny comments that the majority of the work that she has done is with owned, semi-owned or unowned domestic cats in urban and semi-urban environments. The residents who participated in the free cat dissexing program in Banyule have stated that it was purely due to cost, that they had not already had their cats dissexed. The fact it is free is why they have been participating, and some of the residents have 3 to 4 cats dissexed at one time. So the NDN Cooperative Desexing Program is flexible, and there are a number of councils who are now choosing to do combinations. Some councils are choosing to offer free dissexing to all residents in their lowest socioeconomic area only, or eligible residents in all other areas can be asked to pay the $50. Another combination that one of the councils has offered is to ask the owner to pay $50 for the first 2 cats, but for subsequent cats, the 3rd, 4th, 5th or 6th cat that they might own, make that free. Because often people can afford in their first couple of weeks of pay to get 1 or 2 cats dissexed, but they can't afford to get them all dissexed in time before they breed again. Some councils include low-cost microchipping in the NDN Cooperative Desexing Program, and our standard has been that the owner pays $5 towards the microchip, the council puts in $25, and the vet agrees to receive $30 while they're on the table for dissexing for the microchipping. Other councils, of course, have their animal management officers able to do microchipping now. They're accredited, and so they offer free microchipping. NDN does find that other government fees are barriers to dissexing and microchipping for people on low incomes or people taking in stray cats. Cat registration is mandatory in some states. In New South Wales, there's an annual permit fee required for the first year, even if the cat is older than 4 months and has just been acquired and is dissexed as soon as possible. And in Victoria, source numbers are now required before a cat can be microchipped, even if taken in a stray cat, and not breeding, exchanging or selling the cat, which was the original intention of the source number. People on low incomes may avoid dissexing and microchipping if it leads to them being able to be traced to pay an additional registration or permit fee. Those wanting to dissex multiple cats or kittens are unable to afford $50 for registration or another fee for many cats that's required in some places, on top of the dissexing and microchipping cat costs. So NDN recommends that councils provide low-cost free microchipping and free registration with the dissexing program, particularly for people on low income or adopting a stray cat or 2 and willing to dissex and microchip them and take ownership, or managing a cat colony in urban areas, and they're busy dissexing and rehoming kittens, monitoring them and making sure their numbers reduce. These people are providing a community service by taking responsibility for an unowned stray cat or cats, and therefore it's to council's benefit to offer them free registration because they're saving them a lot of cat costs, which we will discuss in more detail shortly. The New South Wales annual permit fee, if a cat is acquired over 4 months of age, has been a barrier as well. NDN recommends councils provide a grace period of 2 months, which is currently allowed anyway for anyone who is found to have not dissexed their cats before 4 months, if people have taken in a stray cat to dissex and take ownership. A free council source number in Victoria has now been found as a solution to the fact that all cats born after the 1st of July must now have a source number before they're microchipped in Victoria. The Pet Animal Registry has allowed councils and organisations who provide subsidised or free dissexing and microchipping programs to obtain a source number which can be used free of charge for people microchipping a cat that they have acquired as a stray. They are not breeders or sellers or exchanging a cat, which was the purpose for which the source number was introduced, and so should not have to pay for their own source number. There are currently 18 councils involved in NDN Cooperative Desexing Programs, some of them just starting out and others that have been with us for several years. 8 in Victoria, 4 in Queensland, 4 in New South Wales, and 2 in South Australia. The budgets for the program have ranged from $1,000 to $57,000 for 1 year. Budgets depend on the size of the population, the community need, and the capacity of council. However, increasingly, councils are recognising it is far more cost effective to budget for dissexing than to have to pay for impounding, euthanizing, or rehoming. We have the details of the differences in costings in our benefits for councils funding a well-structured cooperative desexing program, which is in a document available both on our NDN website and our G2Z website. You can find them at these addresses here. So I'm now going to go through a little summary of that benefits doc to explain to you what you could perhaps explain to your councils to persuade them to fund the program. So first of all, one of the biggest areas that council are concerned about is their budget. And this diagram shows that it's far cheaper to fund dissexing subsidies than to have to go out and collect an unwanted cat, impound it and euthanize it. So in Queensland, for example, a cat must be held 3 to 5 days in the pound, after which it can be killed or rehomed by a council. So on average, for 4 days, it costs $400 to go out and send an animal management officer out to collect a cat, hold it for 4 days, and then euthanize it. In some states, cats have to be held 7 to 14 days. In Victoria, it's 8 days. So we've done another example here on the second row, where if, for example, on average in New South Wales, a cat needs to be held for 10 days, that's a cost of $750 per cat. The council dissexing subsidy cost, on the other hand, is just $125 on average, if you average out between the cost for subsidising a male or a female cat and include the amount that is generally covered for helping pregnant cats. So $125 from $400 means a saving of $275 for preventing that unwanted cat, and $625 in a council area where a cat has to be held for 10 days as an average. If a council chooses just to put in $37,500 to desex 300 cats at this rate, then there would be a saving of $82,500 and a saving of nearly $200,000 in New South Wales. The savings are even more astronomical if councils are rehoming cats, which more and more councils are realising they need to do, since it is unacceptable to the community to euthanise all the cats they bring in. So the savings, if a cat is collected, held and rehomed, is $1,000 for a cat that is impounded for 4 days and then held until it's rehomed with all the associated costs and dissexing, microchipping, vaccinated, worming and so on. And For a 10-day impound plus rehoming time and costs, the cost for council would be on average $1,360. If you take away $125, which is the cost to dissex a cat rather than bring in an unwanted cat, you'll see that the savings are nearly $1,000 per cat for councils and over $1,000 per cat in areas where cats have to be impounded for longer. And so by investing in just $37,500 to desex 300 cats rather than rehome 300 cats, the saving ranges between $262,000 and nearly $400,000. Of course, the other benefits are reducing the numbers of incoming kittens that have to be brought in, which can be devastating for staff and for the community. So there was a 60% reduction in the number of kittens coming into the City of Gold Coast Pound and Shelter between 2005-06 and 2020-21. And you can see there that the numbers have gradually reduced until they've become a sustainable level. And I'm just looking up my notes here. In 2021, only 49 kittens had to be euthanized due to untreatable health issues. Lowering cat euthanasia rates overall, you can see, I didn't know the figures for 2005-06 for cat euthanasia rates in Victoria, but we know from research that was done in 2018 that around 2016-17, Victoria on average, the mean euthanasia rate was 48% in Victorian pounds. That was our euthanasia rate back in 2005-06 on the Gold Coast, in the City of Gold Coast, and it's now down 8%. By 2016-17, it was down at 8% and has been maintained at 8 to 10% since then. So that's a reduction of 40%. So there's a huge difference. And yet only 14 of the 35 councils who provided information on strategies for the research ran subsidised sterilisation programs, and there are 79 Victorian councils. Positive animal management strategies mean greater satisfaction for the animal management staff and also the whole community. It also reduces stress from having to euthanise animals, so that's another huge benefit. With NDN managing all the calls, the voucher issue and vet payments, animal management officers have more time to visit residents in low socioeconomic areas and locate people with excess cats to offer vouchers and help get cats to the vet if needed. For example, provide carriers and transport sometimes. They can find semi-owners by walking around in the community and finding out who's feeding stray cats and encourage them to take ownership by offering a free low-cost dissexing or free microchipping and free registration. And they can also support groups who are willing to desex, microchip and care for groups of unowned cats in their urban area till their numbers reduce. Having a dissexing program also helps people comply with dissexing and breeder permit laws. It enables the ACT, Tasmania, Western Australia, South Australia, New South Wales, who have legislated requirements to dissex cats, to actually provide support. And we believe that state government and council should support those in the community who have limited capacity to comply with this legislation. It reduces nuisance issues. Fewer unwanted animals born means fewer stray, wandering animals. This means fewer issues for non-pet owners as well as pet owners. A reduction in complaints to councils is also a good thing. A South Australian study in 2014 showed that 46% of owned cats are not contained to their property at all times, and less than half of owned cats are dissexed at 3 to 6 months. So that means that undissexed wandering cats can therefore breed and contribute to the unowned cat population. Research shows that by dissexing unowned cat populations, their numbers can definitely be dramatically reduced. A Trap, Dissex, Adopt, Return and Support program by Professor Helen Swarbrick on an Australian university campus in Sydney reduced a free living cat population from 69 to 15 cats in 9 years. All cats living on the campus were desexed, microchipped, registered and fed on a daily basis. 19 campus-born cats were desexed and rehomed. A further 34 cats who immigrated into the area were managed. They either joined the resident colony and were desexed, or they were desexed and rehomed, or they were desexed and died or disappeared. Institutional support for the program was strong because of a reduction in complaints from campus staff and students, and minimal institutional costs, and the improved health status of the remaining cats. By utilising the community in such programs, councils can also save huge amounts of money, reduce complaints, and reduce the numbers of wandering cats. Because both pest management and domestic animal management departments benefit from these desexing programs, we believe cooperative desexing programs should be co-funded by both animal management and pest management departments within council, and similarly encouraged with state governments, relevant departments helping with incentive funding. Another huge benefit is the community can and will help if a more ethical approach is used than killing. Compassionate members of the community will adopt or rehome stray and unsocialised cats if they have access to low cost or free desexing. Many of these frightened cats can become rewarding companions. This little kitten in this photo was adopted by a mum with 2 young boys. We tried to dissuade her from adopting this kitten as it was unsocialised. It was a wild kitten from a mother cat that had been trapped, and we were fearing the boys might be bitten or scratched, or the boys might terrify the kitten. However, she had taught her boys patience and kindness. She was determined to save this little cat, and so the kitten was able to settle in really well and became a valued part of the household. Finally, I'd like to explain the easy process for introducing an NDN desexing program into your community. First of all, NDN provides the information, a summary of the Cooperative Desexing Program and the benefits to councils' documents to present to managers and councils to help them understand the benefits of funding a desexing subsidy program in their annual budget. NDN then invites the vets once funding is approved, and as long as at least one vet accepts the program can proceed. Council then pays the budgeted amount to the NDN to enable payment to the vets on behalf of council. NDN then prepares promotional flyers with your council logo for councils to print and distribute in the community and in a social media format as well. NDN promotes on the NDN directory and through social media, and councils promote on their website and social media. NDN provides a media release for councils to modify and add their own quotes for the program launch. Residents then phone NDN on a 1300 number to determine if eligible and are offered a choice of participating vet clinics. Desexing vouchers are then sent to the residents with an expiry date of 1 month to encourage use as soon as possible. Cat owners then make the appointment with the chosen vet clinic. The owners give the voucher to the vet clinic at the desexing appointment and pay their contribution. NDN then emails a claim form to vet clinics at the end of each month and reimburses them using council funds. NDN also keeps the records and provides reports on numbers desexed and funding used to councils as needed, with an annual report at the end of the year. It's important for councils also to gather data annually to assess progress. As a minimum, councils should be gathering intake numbers and number per 1,000 residents, also by suburb if choosing to target specific areas, which is a good idea. Euthanasia numbers, percentage of intake and number per 1,000 residents are also important, and nuisance complaint numbers to track whether nuisance complaints are going down. So what's great about proactive cooperative desexing programs? Well, not only a reduced cost to council, but positive and ethical outcomes for local governments, owners and carers in need, non-owners, vets, cats and dogs, and wildlife. We look forward to helping you. We would love to know about your existing desexing programs that you offer, or your interest in starting a council NDN cooperative desexing program. Our program is regularly reviewed and adapted based on research evidence of what is most effective, So please keep in touch, as there could be changes along the way. The NDN website directory exists to help promote all dissexing programs by councils and other organisations. So please register your interest in a council NDN cooperative dissexing program, or list your own dissexing program for promotion through the NDN website. You can actually go to NDN, click on Get Involved at the top, as you can see in that left-hand slide, and then go to council or organisations, and you'll see some forms to fill out, or you can simply email info@ndn.org.au. And you're very welcome to contact me at any time if you would like to discuss the program, or our NDN manager, Claire Barley, on info@ndn.org.au or 0755 099 044. Thank you so much for your interest in this program, and we look forward to hearing about your programs or your progress and helping you if we possibly can.
How's that for timing? Joy must have done this before. All right, we've got some questions here.
Oh, fantastic. Should I put my chat on?
Yes, yeah, you can do. That's fine. So they're in the Q&A. Christina would like to know which councils are offering the program at the moment, the Cooperative Desexing Program.
Okay, so I did list those on a slide back further. I'll just see if I can. Is it still showing the slides? No.
Yeah, it is. And I will also put a copy of the presentation along with the recording on the website. So you'll have access to the recording plus the actual presentation itself. So
fantastic. So I'll just flick back to that slide so you can see which councils. Some of them are brand new and we're just currently contacting their vets and setting up the program now, and others have been going for a couple of years. So that's the councils that we're currently working with to either set up their new programs. Fortunately, the Victorian government recently provided some more incentive for for councils to offer dissexing programs. So we suddenly have 3 new councils coming on board in Victoria. Some were already with us, who had already been funding the NDN Cooperative Desexing Program anyway. Yeah, so the program is growing and changing all the time.
Fantastic. Lisa asks what you think the biggest barrier is for getting councils on board with the program.
I think councils are becoming more aware now. In the past, it was a lack of awareness. They were used to working in a reactive mode, and it hadn't become obvious that this was the best solution to actually prevent the cats in the first place. But I think the second reason is that there's not an awareness of how much they can save money by actually funding a dissexing program. So helping councils be aware that it's far more cost effective, as well as far less stressful on the whole community if they fund dissexing, is the biggest thing to try to get across.
Yeah, I'd agree. Awareness of the program itself, and then awareness of the benefits, as you say, Joy, and those documents are there on the website that people can share at any time, and obviously put, any council workers that in touch with Joy. Christina asks, did Banyule use the NDN program or did they develop their own program?
Okay, Banyule developed their own program. So Jenny Cotterill has been extremely proactive, and she has developed her own program. So while the model, she's been highly successful, and she wasn't running an NDN cooperative dissexing program. She's managed it all herself. Yeah, great credit.
She's pretty amazing.
Amazing. Yes. And I guess we're not averse to anybody. We'll help anybody who wants to run their own program just by offering guidance and support or documents if you need it. I mean, NDN gets nothing out of running the programs for councils. We don't take any management fee. We just really believe that this is such an important solution. And so we will help whichever way you want to go. If there's a council that want to run their own program, we'll help in any way we can with advice or resources. But if you need help, there are some councils who do need the help to actually help run their programs, and we're happy to do that as well.
Lisa mentions that she's disappointed not to see more councils here today, and is there a better way to reach them? We actually, or Joy delivered this webinar to the Australian Institute of Animal Management, which is a member-based organisation, Lisa, maybe 12 months ago. I'm not sure, this year's gone.
Yeah, I think it was right at the beginning of this year or the end of last year. Yes.
Right.
Yeah.
So the awareness, we are targeting animal management itself, and also this recording will be available, and the presentation, to anyone to access at any time. No membership or anything required. So you can share it as much as you like, and you can direct people to the website, and we will let people know about it that way.
And we also do presentations, of course, Nell, don't we, to various conferences, and was fortunate enough to be given the opportunity to speak at the Animal Welfare Victorian Government webinars for their councils at the end of last year. And I'm sure that, that led to an immediate response, and I'm sure that led to us having now 3 to 4 new Victorian councils on board.
Yeah, absolutely.
So once they find out about it, they are normally very willing to participate. It's just a constant sort of continuing to get the message out there.
Lisa's asking, what month is National Dissexing Month?
Okay, National Dissexing Month we hold in July because it gives plenty of time before the spring breeding season to dissex as many animals as possible.
And what's the best way for Lisa to get on the mailing list for that, Joy?
So if you could send an email to info@ndn.org.au. I'm not sure whether Lisa is a vet clinic or is a individual person or a council, part of a council, but if you just send an email to info@ndn.org.au, explain who you are and what you would like support with, we'd be very happy to put you on any list we can to help you.
Great. And do NDN have any case studies from cat owners who have used the program?
Well, that's an interesting point. We haven't put up any case studies about that yet, but we probably should.
Yeah, I think that's a brilliant idea.
It is a good idea. We do get lots of feedback, and people are so overwhelmed and happy to be given the support because not only, do we provide this support all year round, but there are some people who are really, really struggling who need extra support, and so we're always there to provide a solution, even if there's currently no program available for them.
Yeah. A different Lisa asks, says I've been running a dissexing program in Geelong since 2018. Go Lisa. Do you offer your program via vet clinics in shelters? Are you responsible for the Dissex July program in Geelong? I'd love some help in Geelong as I have only one vet on board, and we do get a discount, but nothing like what you guys could offer. Wow, I could have dissected so many more cats at those rates. Yeah.
Yes, it is always a constant battle, keeping the price as low as we possibly can. And so I'm not sure, you know more about Geelong than I do, Nell, so maybe you can just comment on that.
Yeah, so Lisa, I think it's probably best if you get in touch with Joy directly, because there's a few parts to your question there, and Joy will be able to help you work it out the best way, to approach it there. But certainly that's the point of this program as well, is to offer support to other programs that the other things that other people are doing. There's no point in reinventing the wheel when there's all this experience and resources available. Jackie says, do you provide support to councils in the preparation of funding applications to support subsidised free dissexing? That's another awesome question.
Yes, well, we always have had the benefits to councils document, which, as Nell said, is available also on our G2Z website and available through NDN. So that's the first thing we do. If councils express an interest or organisations that want their councils to participate express an interest in running an NDN Cooperative Desexing Program. We have that benefits to councils document freely available, which we've recently just updated again, which shows a lot of the things I've presented in the slides today about the successes, the costings, and all those sorts of things. And so quite a number of councils have used either the whole document or extracts from that document to help convince their councillors that this is a very wise decision to make. And so that is available. And we're also always involved in research projects and looking at research. So we try to update things as we go along so that we are familiar with what research might help councils to come to some good decisions.
Yeah, absolutely. Lots of feedback saying thank you for answering all the questions, Joy. Joy is just a font of information in this space. Oh, Anne Enright is saying, I can help Lisa to sex cats in Geelong. Woo!
Oh, fantastic. Anne, that's great.
So, Anne, in the chat, do you want to just pop your email address in so Lisa can contact you?
Yes, because one of the very exciting things from hearing Anne's presentation in the last month for our G2Z webinars was that there are now several community clinics in Victoria, which is exciting because that really does help. But we also acknowledge that there's not an opportunity to get community vet clinics speedily up all over Australia. And that's why we set up the program the way we have. Because we usually can find some community-minded veterinary clinics who are very happy to participate and help out in this very worthwhile cause.
Yeah, fantastic. All right. Thank you very much, everyone. Lisa Ann has just popped her email address up in the chat if you want to grab that. As I said, the recording will be up on the website, hopefully by tomorrow, with the presentation, a PDF of the presentation. So thank you very much, everyone, for attending today. And thanks so much, Joy. Great discussion, fantastic questions and ideas from you guys. And this is exactly what we need, always the feedback. So make sure you're signed up for our e-news and tuned into our social media to find out what we're doing each month in this space with our online events. Hopefully one day we'll all be able to see each other in a room again. And feel free to send us through any suggestions for topics or speakers that you'd like to see in this series. I just want to give a shout out to Fablo from Brazil, I think, who attended today. Really great to have you here. Thank you very much. Hi from all of Australia, and have a great day, everybody. Stay safe, and we shall see you next month. Bye.
Everyone, thanks, Nell. Thanks for organising.